This video gives an overview of 3 commonly used interrupted sutures: the simple interrupted, the vertical mattress, and the horizontal mattress. Any good wound closure starts with the proper equipment. Begin with a pair of sterile gloves. Find a pair of straight scissors, a standard needle driver, a pair of toothed adhesins, and of course, sterile suture. Before we get sewing, let's review the indications for a simple interrupted suture. The simple interrupted suture provides a good aesthetic outcome for most uncomplicated wounds, provided that the wound is not under excessive tension. We have marked out our entry and exit points for our 3 types of sutures, to aid the learner in visualizing proper suture placement. We have the entry and exit point for the simple interrupted, the entry and exit points for the far portion of the vertical mattress, as well as the entry and exit points for the near portion of the vertical mattress. Note that these form a straight line. Finally, we have the entry and exit points for the horizontal mattress, which form a square. For the simple interrupted suture, begin by grasping the right wound edge with your adhesins. Have the needle enter the tissue at the right wound edge at an angle of 90 degrees. Advance the needle into the subcutaneous tissue and then twist your wrist, making the needle exit the subcutaneous tissue out into the wound. Reload your needle and enter into the subcutaneous tissue on the left, opposite of where your needle exited on the right. Again, twist your wrist so that the needle exits the skin on the left wound margin, the same distance from the wound as your entry point on the right. Congratulations! You've now placed the simple interrupted suture, which can either be tied by hand or with an instrument tie. Once you have tied your knot, slide it to the side so that it doesn't sit in the wound and impair healing. Next, let's review the indications for a vertical mattress suture. The vertical mattress is best suited for closure of wounds under tension, such as lacerations over a joint or bony prominence. The vertical mattress is also useful for wounds with a tendency to invert, especially in concave areas such as the antecubital fossa. In starting a vertical mattress, the technique is similar to the simple interrupted suture. Begin by grasping the right wound edge with your adhesins. Enter the skin with your needle at 90 degrees between 4 and 8 millimeters from the wound edge. Advance the needle into the dermis. Twist your wrist to have the needle exit from the wound. Reload your needle and enter the left subcutaneous tissue opposite of where you exited on the right. Advance the needle horizontally, then twist your wrist. Exit the skin on the left, the same distance from the wound edge as you entered on the right. This will be the far throw, which acts to approximate the tissue. Next, reverse load your needle. You will now throw the near stitch that closely opposes the wound edges and everts the tissue. Enter the left skin, in line with your far throw, but closer to the wound margin. Aim to exit the skin at the dermal-epidermal junction. Once your needle pierces the skin on the left, you can either exit from the wound and reload your driver, or proceed directly with placing your final bite. Begin your right-sided bite at the dermal-epidermal junction and exit the skin in line with your previous throws. Symmetry is particularly important for the near throws, as this avoids one skin edge being higher than the other, which will create a skin shelf. Tie your first knot and pull the suture tight enough to approximate the tissues and evert the wound edges, but be careful not to pull it so tight that the wound is strangulated. Continue with 4 to 5 additional throws to secure your vertical mattress. Again, slide your knots to the side. The final suture we'll demonstrate is the horizontal mattress. The horizontal mattress distributes tension along the wound edge and is thus most commonly used for high tension wounds or to approximate a gaping wound. For the same reason, it is also indicated for the closure of wounds and fragile skin, such as in the elderly or patients on chronic steroids. The horizontal mattress also begins similarly to a simple interrupted suture. Place 2 throws as you would if you were performing a simple interrupted suture. After your initial 2 throws, reverse load your needle. In essence, you'll be throwing a reverse simple interrupted suture. Enter the skin on the left, proximal to where you exited the skin, the same distance from your previous throw as you are from the wound margin. Once your needle pierces the skin on the left, you can either exit from the wound and reload your driver, or proceed directly with placing your final bite. To place your final bite, enter the subcutaneous tissue, advance your needle, and twist your wrist to exit the skin. The 4 entry and exit points should form a square. Pull the suture ends and ensure that the wound edge is everted prior to tying your horizontal mattress. You can now tie tight enough to evert the wound edges, but again avoid strangulating the tissue. If the wound is under significant tension, consider placing a pledget or a piece of gauze between the skin and the suture loops prior to tying, since this will distribute the force applied to the skin and reduce scarring. Finally, pull your knot to the side. Once you've completed closing your wound with an appropriate interrupted suture, dress the wound and safely dispose of sharps and garbage. Thanks for watching our video. We hope you found it helpful.